Here's a shocking reality that might surprise you. While 359 million people worldwide grappled with anxiety disorders in 2021, making it the planet's most prevalent mental health condition, only 1 in 4 sufferers actually receives proper treatment. But here's where it gets controversial. Is this treatment gap a result of societal neglect, or are we perhaps overdiagnosing what might simply be normal human responses to an increasingly stressful world? Critical statistics that demand attention. The numbers paint a startling picture of global mental health. In 2021, anxiety disorders claimed the unfortunate title of being humanity's most widespread mental health challenge, impacting 359 million individuals across the globe. What's particularly concerning is the gender disparity. Women face significantly higher rates of anxiety disorders compared to men, though researchers continue debating whether this reflects biological differences, societal pressures, or diagnostic biases. Perhaps most troubling is that anxiety symptoms frequently emerge during our most formative years, childhood and teenage periods, when young minds are still developing their coping mechanisms. Despite the availability of highly effective treatment options, a staggering 3/4 of those suffering from anxiety disorders never receive professional help for their condition. Understanding the anxiety experience. Everyone encounters moments of worry or nervousness. That's completely normal human behavior. However, individuals living with anxiety disorders face an entirely different reality. Their fear and worry reach intense, overwhelming levels that far exceed typical responses to stressful situations. These overwhelming emotions come bundled with physical tension and create a cascade of behavioral and cognitive disruptions that feel impossible to manage. The persistence of these symptoms sets anxiety disorders apart from everyday stress. Without proper intervention, these conditions can persist for months or even years, significantly disrupting family relationships, social connections, academic performance, and professional success. Current global data suggests that approximately 4.4% of the world's population lives with an anxiety disorder at any given time. But here's what most people miss. The treatment gap isn't just about individual suffering. Multiple barriers prevent people from accessing care, including widespread ignorance about anxiety being a treatable medical condition, insufficient funding for mental health services, shortage of qualified healthcare professionals, and the persistent social stigma that treats mental health struggles as personal weakness rather than legitimate medical concerns. Recognizing the warning signs. Individuals with anxiety disorders typically experience overwhelming fear or excessive worry that focuses either on specific triggers, like social interactions or potential panic episodes, or, in cases of generalized anxiety disorder, spreads across virtually every aspect of daily life. These symptoms must persist for several months to warrant a clinical diagnosis, and sufferers often develop avoidance behaviors that further limit their life experiences. The physical and emotional symptoms create a complex web of distress that includes difficulty maintaining focus or making even simple decisions, persistent irritability combined with feelings of tension and restlessness, gastrointestinal problems including nausea and stomach discomfort, cardiovascular symptoms like heart palpitations, visible signs of distress such as excessive sweating or trembling, sleep disruptions, and an overwhelming sense that something terrible is about to happen. And this is the part most people miss. Anxiety disorders rarely travel alone. They significantly increase the likelihood of developing depression and substance abuse problems, while also elevating the risk of suicidal thoughts and behaviors. This interconnected nature of mental health conditions makes early intervention absolutely crucial. The various forms of anxiety. Anxiety manifests in several distinct forms, each with unique characteristics. Generalized anxiety disorder involves persistent, excessive worry about everyday activities and events that most people handle without distress. Panic disorder centers around recurring panic attacks and the constant fear of experiencing more episodes. Social anxiety disorder creates intense fear and worry about social situations where the person might face humiliation, embarrassment, or rejection. Agoraphobia involves excessive fear and avoidance of situations that might trigger panic or create feelings of being trapped or helpless. Separation anxiety disorder manifests as extreme distress about being apart from emotionally significant people. Specific phobias create intense, irrational fears of particular objects or situations that lead to significant avoidance behaviors and distress. Selective mutism, primarily affecting children, involves consistent inability to speak in certain social situations, despite speaking comfortably in other environments. Many individuals experience multiple anxiety disorders simultaneously, and symptoms typically begin during childhood or adolescence before continuing into adult years. The gender disparity becomes apparent early, with girls and women showing higher susceptibility than boys and men. What triggers these conditions? Anxiety disorders emerge from a sophisticated interplay of social, psychological, and biological influences. While anyone can develop an anxiety disorder, individuals who have experienced abuse, significant losses, or other traumatic events face elevated risk levels. The relationship between anxiety and physical health creates a complex feedback loop. Anxiety's physical manifestations, including chronic muscle tension, nervous system hyperactivity, and problematic alcohol use, serve as risk factors for cardiovascular disease and other medical conditions. Conversely, people managing serious physical health conditions often develop anxiety disorders due to the stress and uncertainty associated with their medical challenges. Effective prevention strategies focus on community-based approaches, including parental education programs and school-based initiatives that enhance social and emotional learning while building positive coping skills in young people. Regular exercise programs have also demonstrated effectiveness in preventing anxiety disorders among adults. Pathways to recovery. Multiple highly effective treatment approaches exist for anxiety disorders, making professional help absolutely essential for anyone experiencing symptoms. Psychological interventions form the cornerstone of anxiety treatment, primarily involving talk therapy with licensed professionals or trained lay therapists under supervision. These interventions help individuals develop new thinking patterns, coping strategies, and ways of relating to their anxiety, other people, and the world around them. Therapy teaches people how to face situations, events, individuals, or locations that trigger their anxiety responses. These interventions can be delivered individually or in group settings, through face-to-face sessions or online platforms, and may be accessed through self-help resources, websites, and mobile applications. Cognitive behavioral therapy principles provide the foundation for the most evidence-supported psychological interventions, including exposure therapy, which helps people gradually face their fears in controlled, supportive environments. Additionally, stress management techniques, such as relaxation exercises and mindfulness practices, can significantly reduce anxiety symptoms when practiced consistently. For adults with anxiety disorders, antidepressant medications, particularly selective serotonin reuptake inhibitors, SSRIs, can provide valuable support. Healthcare providers must carefully consider potential side effects, their ability to deliver various treatment options, and individual patient preferences when making treatment recommendations. Interestingly, benzodiazepines, historically prescribed for anxiety disorders, are generally no longer recommended due to their high dependency potential and limited long-term effectiveness. A shift that some argue doesn't adequately address the immediate relief many patients desperately need. Taking control. Self-care strategies. Self-care practices play a vital supporting role in professional treatment. To help manage anxiety symptoms and promote overall well-being, individuals can avoid or significantly reduce alcohol consumption, while completely avoiding illicit drugs, which often worsen anxiety symptoms. Regular physical activity, even brief daily walks, provides significant benefits. Maintaining consistent eating and sleeping schedules while following a nutritious diet supports both physical and mental health. Learning and practicing relaxation techniques, including controlled breathing exercises and progressive muscle relaxation, offers practical tools for managing acute anxiety episodes. Developing a regular mindfulness meditation practice, even for just a few minutes daily, can create lasting positive changes in how the brain responds to stress. Global response and future directions. The World Health Organization's Comprehensive Mental Health Action Plan, 2013 to 2030, outlines essential steps for providing appropriate interventions for people with mental health conditions, including anxiety disorders. The WHO MHGAP program specifically addresses generalized anxiety disorder and panic disorder, aiming to help countries expand mental health services through care provided by healthcare workers who aren't mental health specialists. WHO has developed brief psychological intervention manuals that trained lay therapists can deliver to individuals and groups. These interventions have demonstrated effectiveness for multiple mental health conditions, including anxiety and depression. The Problem Management Plus PM Plus manual, based on cognitive behavioral therapy principles, incorporates stress management, problem-solving treatment, and social support strengthening techniques. Additionally, the Self-Help Plus SH Plus group-based stress management course and WHO's widely used Doing What Matters in Times of Stress self-help resource describe practical skills for reducing anxiety and stress. The controversial question we must ask, here's where opinions might clash. Given that anxiety disorders are simultaneously the most common mental health condition and the most undertreated, are we looking at a genuine medical crisis, or have we medicalized normal human responses to an increasingly demanding world? Should we focus more resources on treating individual anxiety disorders, or should we address the societal factors, economic instability, social media pressure, environmental concerns, that might be creating widespread anxiety in the first place? What's your take on this? Do you believe the treatment gap reflects a failure of our healthcare systems? Or do you think we need to question whether we're pathologizing natural human responses to modern life's challenges? Share your thoughts. This conversation affects millions of people worldwide, and every perspective matters in finding better solutions.